Mrs. Padma and Dr. Vishaka. You like that? I'm very happy, in fact, on behalf of the Salla Neuro wing of the Clinic and Nursing Home, in welcoming you all for this Neuro Conclave, the main on the very important topic on Parkinson's disease. We have organized on it actually to commemorate the memory of family members of doctors. Dr. Salla prepared her degree of MBBS in 1947 and from Madras Medical College at a time when those who got the degree were flying off abroad. She decided the other way. She said no. She settled down in the village. Our neurosurgeon, but he has got about 4 or 5 IAS brothers. The whole family, everybody was, the delivery was by Dr. Salla Parkinson. She conducted the delivery for the whole family. She was such a popular doctor, in fact, during those days of the late Chief Minister M.G. Ramchandran, she was in fact requested even to contest the elections. Personally, she guided beyond the call of duty the career of many poor students. Organizations helping the poor, and she did travel worldwide too. Soon after MBBS, I didn't know anything about head injury. Somewhere in CMC Vellore, and while my wife and myself on a Sunday evening after a movie, when we came back, we were told, and we rushed back, we rushed to Vellore. And I was in fact taking her in an ambassador car towards Institute of Neurology. And I didn't know what was the process. She had a hemiplegia. At that time, we didn't have CT scan or MRI. 6 weeks, it was a mental turmoil with the Institute of Neurology, and subsequently Professor Narendran is a brother of Dr. Salla. He took his MBBS from Madras Medical College in 1950, Ephasius from London, Edinburgh, and MS Neurosurgery subsequently from the Madras University from CMC Vellore. His examiner was Jacob Chandra. And he climbed the ladder of glory he brought in the CT scan. Now how he got it is very interesting, because if you go until at that time the CT scan was only head scan, and the value of it was around 65 lakhs. Just total head scan, that's all. And this was the second head scan brought to the whole of India. The other was in Delhi. Now what he did was, when our Chief Minister, that time was M.G. Ramchandran, when he went over to Japan, he saw to it that Professor Kanu and his team visited him and impressed upon him the importance of CT scan. And when that was conveyed to him, he said, this is very important, and we must see that our patients are being saved. And that was how the CT scan was brought in spite of much of opposition was there at that time, because this is to one department specifically, or giving around 60 to 65 lakhs. And that really affects. And craniotomy and acupuncture anesthesia, he was a very skillful neurosurgeon. And it was an ace to see him operating, actually neurosurgeon. In fact, he simplified and reduced the mortality as well as the morbidity in neurosurgery, especially in the posterior fossa surgeries. He also did a study, M.G. Ramchandran at that time, and remember, he went to Boston, and when the surgery was there, he was inside, and he carried his papers through down. And he was the person instrumental in bringing Professor Tetsuo Kano and his whole team, and you know, it has become almost a history now. We have all the modern gadgets like CT scan, MRI, PET. Even today, we diagnose Parkinson's disease at the bedside based on the tremor, rigidity, bradykinesia. No advances have been made in the last maybe 195 years. Again, even today, we diagnose it only by the bedside. Though 200 years ago, James Parkinson has described, if you look into the Ayurvedic literature, deep brain stimulation department for Parkinson's disease in SRM Medical College very soon. And we have, and now I invite the two chairpersons, Pesh, former professor of neurosurgery, Institute of Neurology. Please, Ramesh, please take the chair. An extremely skillful surgeon, neurosurgeon, and a great academician. We are really honored, Asian, and a par excellent neurologist, I must say, which has got special field of interest. Professor V.K. Ramesh. R. Bhupati. Invite the speakers. Professor and Head of the Department of Institute of Neurology and former Dean of his own medical colleges here.
Respected Professor Girish, learned professors, to remember to renew Parkinsonism. But this time